talk about data detectives, 10-year-old view on their health data and how it should be used. Before that, let me introduce myself. I'm Sandeepa. I'm a researcher at Imperial College London. I just finished my PhD last year. Prior to that, I had been working, I started my career as a health policy think tank. I'm an economist by background, and I work in health capacity, and I ran National Neonatal Audit as an analytical lead, work in health setting of linking education and health data set. All to set the scene that I'm really out of my comfort zone when talking to 10-year-olds about data, because all I do is data, but don't go around talking about it. So my line manager, Professor Dougal Hargreaves, who's also a pediatric, they talk about children being for in front of pediatrics and talking to them about children. It's embedded in clinical care in pediatrics. So he pushed me, now you do data, go talk to 10 years old about data. So this is sort of my experience, and I was supported by the team, and I believe Charlotte, who's part of my team, was there throughout this whole project. So let's go about talking, let's see if I can. So why children's data matter? Children's data is everywhere. It begins far earlier than we can think about, during the time of conception. And then this information, we don't really realize when their digital footsteps start being recorded. And it's everywhere. It's in their schools. The data is coming from the schools, their healthcare, local authorities, services the family interacts with. This data is not very unusual either. So it's kind of like attendance records, their assessment, immunizations, the normally administrative data. We record this, the system is recorded because to help the system, to function it. And these pieces of information collectively shapes how decisions are made for them. As they grow, you will see they will start generating even more data. Their digital footstep about banking, online learning, all this footstep, wider complexity around their data. This is where they sort of keep on growing. And we talk about transparency, but how this data is gathered and its uses need to be understandable. And it's not just for us adults, but also to children, because transparency is just not an ethical principle. It's also our right. We go and buy stuff from supermarket, we look at its ingredients because we think it's our right. So talking about data and explaining that, sorry, my dog joins this conversation. So talking about this information to children is their right. And also legally, under the UN Convention on the Rights of Child, children have the right to be informed and the right to have their views taken seriously when decisions affect their lives. But we really go about asking them why their data is used, how it's being used. So we started this project just to see if we know that data is everywhere, can we have a conversation about their data to them? And what might happen if we just ask them and give a space to them to talk about what do they actually think? So that's the whole premises of this project. Now, why children's views and health data matter? So people, us generally, and also children, we only see our data from like GP data, hospital data. So the idea that this data actually can be used to plan services, support systems, and research is immediately not clear. We just don't know. This is the data I use every single day, but yet I have difficulty explaining to even my friends how what I'm using is actually helpful to them directly, because clinical care, they understand that they need this information for clinical care, but how research would directly help them is sometimes not that very clear. Also, different users can bring different kind of benefits, and so we need different kind of privacy concerns about them. Now, they're fine, for example, most people are fine, not just children, sharing data with doctors, but not to other people. And we have to involve children in this conversation because they might think risk and benefits different from us. And we need to know what are their risks, what are their concerns. We also know there are some groups of children which we rarely hear from. So certain groups like children who have diabetes, learning disability or asthma, those groups are formed. So we can go and talk to them about it. But what about the general population who's not very distinctive in terms of their condition manifestation? So views from children in diverse communities, or some less represented, whether it be ethnic minorities or people who are not that well off, like they are missing, and we need to hear from them. And we also know that talking, communication, it builds trust. And we need to understand how children see this risk, benefits, and fairness. So in general, when people feel heard, it really does strengthen the case of trust. It also gives us better evidence on what fairness feels like. So what did we do? We actually went to a local school in Northwest London, a year 5 class. So this is 9 and 10-year-old class. And this was a really fantastic class to work with because these year 5 are on the cusp of going to secondary school. So they are in that transition phase. They're kind of like in elevated level of primary school, but they are next step is almost feel very grown up to them. So we partnered up with the year 5 class in Northwest London, and we met them every week. So it went about like for 6 to 8 weeks. We get to know them, feel comfortable speaking openly in that space. We also work, now this I must really highlight, closely with the specialist in participatory method, because without Esther Orchard, who was our lead in this, we would be hopeless to go and talk to children. And a person you see on the slide is Nick, the adult, and he is a senior statistician who went with me to this class. And this Nick himself is self-admitted, say he's a data geek. He eats equations for breakfast. So he was a classic case for us to take with me to talk to children about data. And children loved him. They actually thought Einstein has come to their class. So it was fantastic to have him embedded in this adventure with me. We went and we start talking to them ideas about data, research, privacy, and we realized we really have to use Esther's method, like working with drawing, group discussion. So one of my first talk with children when I first opened the gates about data is like, what do they feel like when they hear the word data? And lots of hands up. And one child immediately told me he thinks data, he knows data because his dad has data roaming on his phone. I was shocked about that because that was completely something unexpected. I didn't think that way because I was working with very different kind of data. So that shows how different children can think. And of course, he was completely right. And that is a data. But how presumptuous of me not to think about it at all. So this is why sometimes dialogues are very important. You hear new things which you don't even think about. So this class, we decided to work. What we did was did a little role play exercise, and we call it data detectives. So what did children do? They created a fictional character. They opened up the conversation about what counts as personal information. And it turned into a two-way learning experience. So as much as they were talking, I was also learning from this new experience. Why we created it? Because, just talking about data in abstract, it can be too hard. It's what is it? And not tangible. So with the game, we kind of made it a bit more tangible. It gave children something concrete to hold on, to draw and talk about. This little character sheet that you see is a kind of information we ask them to fill about. So this is an example of a character sheet that children put together. So how the game started, we began asking children design a character, a fictional character. I highlighted that point many times, a fictional but a believable character. So don't talk about your parents or your siblings or friends. it didn't really far too stretched. Often you see their own self-reflected or sometimes exaggerated version of themselves, what they like to be seen as manifested in this creation. They chose details about, like, we asked them about like what this character's family life would be like, hobby, school. This kind of information is count as data. So simply drawing and describing the character really open up a natural conversation. So the game in action, we had start playing with them, their character once they had made them. They talked openly about them, and we asked simple question what the character might share and why. And this made them talk about privacy a bit more easily, letting them choose what they want to share and what they want to not share and why. So we've talked, it just basically opened the door to talk and talk about data without lecturing them. And what it achieved, we heard their concerns, their assumptions, what it feels okay to share and what it doesn't. They also challenge us. So some of the questions we want to ask them, like, okay, give me this information. They're like, why do you need it? What are you going to do with this? Is it necessary for you to have this information about me? So it really helps us think about that, their perspective in this case, what they're willing to let go and what they're not. And we gain insight how they are start to process this data as health data and privacy and the trust things I struggle to talk to adult in general. So I start to openly talk to them about this without any preconceived notions. And what children told us about this whole game, they loved working in a group. And I understand why, because it really does give them mayhem to cause, talking in groups and just playing around. But it was actually quite useful. It's also about the peers, what other things really matter to them. So we start to see how the dialogue is changing when they are with other children. They understood the concept of trade-off very easily. They understood, okay, and sometimes they're willing to let go information quite easily when they see the benefits, but they understand the risks. To give you an example, it's like, okay, if I give my data, would I be allowed 1 hour of free game time? So they're willing to let go of certain information to get something out. But then, like, okay, not more than 1 hour. Maybe they will be, calculating more digital steps about me, and that'd be too risky after that. So I love this idea of quick thinking and trade-off being made right there. They were very concerned about some home information. They don't really want to share too much private detail. They were worried about hacking all the time. The topic about hacking came several times. Hacking, somebody would find out where I'm living and I will get burgled. So this sort of like danger about data sharing out there with strangers was there. They were very comfortable to share with data once you explain what you're doing. Like when I explain I use this information, like I did my PhD on asthma and I need to understand whether a child lived near the park or not. And would this information be okay if I know who's not Harry but a child? So I take the personal identifier and make it like a de-identifier. Would it be okay? Very comfortable. When they see it's being used something to help them, not for commercial gains, they're very happy to go. Clinicians, they were very happy to share information. And we also realized over the time, their understanding of data changed from my first talk to them about data and data roaming. They understood one point, that data is them. They hold information that somebody wants to have it. I found that was a very profound thing that they picked up after series of these events and games we played. They very much liked being involved, important. It felt very much fair to them that they've been asked. They really showed capacity for this nuance emotion, this handling complex ideas and privacy, purpose, confidentiality. But surprise, of course, they handle ideas. They push back when they think the information is not needed. They spotted motives. What is the purpose? Why are you collecting this information? And they recognize their own sense of agency, their own role. they loved being involved. They wanted to be involved. At the end, I think why this all matters for data transparency, because children notice sometimes things which adults often miss. They really do care about fairness, purpose, and who benefits. They want to understand. So we really need to cultivate good habits early on, because this is what the future holds for them. Talking about data, there's the social media, the digital footsteps. So having early talk is actually quite useful. And in a way, if we want data system to work for everyone, we really need to include those who usually get left out. And at the end, we invited all of the class to come to Imperial and cause as much chaos as they can. And they received certificates, and it was a fantastic day out for all the researchers and children. Again, I would really like to thank, it wasn't just my solo effort, it was a team, Charlotte and Professor Drucker Hargreaves, who was very top down thinking that it has to go out, we have to go data people to children, and Esther, who was a specialist. Without her, we'll be completely lost. Nick and me would be like, no idea how to go about talking to a 10-year-old. I'd be happy to take any questions, and thank you for listening to me.